Welcome back to the Metacognition Mondays with Antony Lo podcast for the Metacognition of Leadership Institute. My name is Antony Lo, your host, and I love making the complex simple. So this episode in Season 1, Foundations of Metacognition, we're looking at metacognition and clinical reasoning. Should be fun. I'm excited to share this with you, because clinical reasoning isn't just about knowledge, it's about knowing how to apply it, when to apply it. So in this episode, we're going to explore how metacognition strengthens the reasoning process by helping clinicians reflect, adapt, and refine their decisions before, during, and after patient care. So we're diving deeper into that process of what we've been talking about so far in the other episodes. So in this episode, we'll be going through the 3 key points of reflection in action versus reflection on action, adapting in the moment, as well as building that clinical intuition. Let's get started with reflection in action versus reflection on action. Reflection in action is the thinking while you're doing it, and reflection on action is about thinking after the fact, after you've done something. Now, we need to do both. It's important to recognize that both needs to be done. You need to be able to course correct during a treatment. If things aren't working out well, it's better to just stop and change direction in what you're doing with people. You need to be able to do this to make sense of outcomes. You can reflect on it later. You can reflect in action while you're doing it, because when the outcomes come, you do a test and there's an outcome, you have to make clinical decisions. And then reflecting on the action will improve your future decisions as well. So reflection in action helps you with the moment-to-moment clinical adjustments. We know about how this works because, you go out, you run out onto the field, and it looks like the person has 2 knees. Reflecting in the moment would be, wow, it should not look like they've got 2 knees. I think this person has a broken leg. I know it's a very simple case. And anybody who's ever done any field work and has helped somebody with a broken leg will know that you just don't forget what they look like. It's that moment-to-moment clinical adjustment. Reflection on action supports that deeper learning and that evaluation of patterns. I remember with that broken leg, for example, okay, this leg is broken and time slowed down for me. I know theoretically what to do. If you'd asked me in an exam, I would have written out a pretty good answer, right? Secure the patient, make sure that they don't move, don't remove anything, make sure that they're comfortable, don't try reduce anything because you can tear blood vessels and they can bleed out. Like all sorts of bad things can happen. Like keep them still, keep them comfortable, call that ambulance. But because it's the first one that I saw, I just remember thinking, wow, I'm moving really slowly. And my friend who broke his own leg knew what to do. So he was asking people to call the ambulance. He was saying, okay, let's get something for their head. Let's keep them comfortable and warm because it's winter. Let's not move them. We've got to stop the game. Like they're not a health professional. He's a printer. And he knew what to do quicker than me because I knew theoretically what to do, but hadn't been confronted with that situation before. The next time something like that happened, I felt a lot more comfortable and at ease to be able to do it because I reflected on that action. I thought about how I reacted and how time slowed down and how I was sluggish in my reactions. So that's why it's important to be able to do both. I knew what to do in the moment. I was just really slow. So that reflecting on that action really helped me with that and so many other examples. So reflection, so both reflection in action and reflection on action require metacognitive awareness, so knowing about thinking about your thinking, and the habits that you use to reflect on that to be effective. And that's what we're going to talk about. So adapting in the moment. You know, the ability to adapt in the moment is desirable. People know that this is a good thing, to be able to respond in the moment. And metacognition will help you sense when a strategy is working or not. And that's important to recognize, to be able to, as you're going through working with somebody, to be able to pay attention and see, oh, they're flinching a bit. Oh, they're pulling back a bit. They're reacting in a way that seems negative. Um, they're, it's not going quite according to plan. Like if you think that they should be doing lunges and they're telling you about a different type of symptom, and you're focused on whatever reason why you got them doing lunges, you may miss that the lunges are causing something else, like an irritation of their low back issues that you didn't know about because it got missed. Like, the person didn't tell you. Stuff like that happens all the time. Be able to adapt in that moment and go, hold on a second, the lunges are right for your knee problem. Like you need to be able to do lunges because that's in the protocol. However, let's just stop and think about that. Let's examine things a little bit further. That's important. And it's that flexible reasoning rather than that rigid protocol following that we're after. For example, when I'm explaining something to somebody, which happens often because I love technical language, the person has a face that says, I've got no idea what you're talking about. And then I go to using other metaphors. Be able to do that instead of using the protocol language or the scripts that you've been taught to say, is another classic one. I see people using scripts. It's like, oh, I know where you got that from. It's that sort of thing. Metacognitive clinicians, they stay attuned to different things. And these are going to be your verbal and non-verbal patient cues. Things that they say, but not only what they say, how they say it, the noises that they make, the actions that they do, the flinching. Like I saw somebody yesterday and I was treating their neck and they were kind of moaning, and I didn't know if it was a good moan or a bad moan. So I said to them, look, I'm really sorry. I don't know your noises. Is that a good moan? Now, some people will moan because it hurts, and other people will moan because it hurts so good. Do you know what I mean? Like, oh, that feels so good. Thank you. I just asked. I had to ask. I noticed it. I'm attuned to it, but I didn't know what it meant. So that's important. You've also got to be attuned to your own biases, your blind spots, your BAMs and your bars, your beliefs, attitudes, meaning, and stories. You've got to know what they are. Always try to have two stories to explain and experience. And your biases and your assumptions. These are so key. And if you don't know what they are, pick them out in other people. You can pick other people's biases and assumptions. It's really hard to pick our own. So pick on other people's ones and then ask yourself, well, what's my bias? What's my assumption? We're also attuned to the need to pivot based on unexpected responses. Now, you can plan for lots of general responses. You know my plan by now. If you've been listening, I have a plan of what to do if it's the same, better, worse, or different. Now, sometimes in those baskets of responses, there's common things that I'm expecting to see, and sometimes there are uncommon things, and I've got to decide what to do that's unexpected. Being attuned to that and then knowing how to respond later is that important thing. So being able to do this will foster creativity and responsiveness in care. A recent example of this um, is that there was a patient who told me that, like, they've got cervical radiculopathy, right? And it's not quite time to to send for an injection or a surgical review. They're not losing power. It's mainly pain. It's only been a few weeks. And they were asking me about acupuncture, dry needling. And I said, look, I do it, but I only do it if I really felt like it would help. But at this stage, I think, you know what? You want it. She'd asked twice for it. So it's like, okay, you want it. I will give it because you want it. And let's see what happens. Now, that's responding to their desire to try it. And for whatever reason, I don't pretend that it works for a particular reason. It seemed to help them. They felt more relaxed, and it seemed better the next time they came, better than previous times. Now, it could just be that they're getting better because it had been a few weeks, and over time people tend to get better. It could be that, or it could be that they felt comfortable that I took them seriously and tried the dry needling, and that was helpful. It could be that my other techniques I was using are helping. There's many reasons why that helped, but it is that ability to respond in the moment and to be able to do that for them. I think that's really important. So staying attuned to that reflection in action and on action is important. Another example of creativity, for example, is the number of different taping techniques that I adapt around the foot, for example. Like, I feel like it needs support here, or, the transverse arch, the distal transverse arch needs to be supported here in this way, or it needs to be a twist here. Like, these are things that I have not been taught. I have this intuition of what might be helpful, and then I tape to try and reproduce that. Now, is that because it's just affecting the dermal layer and the nerves in there? Is it truly affecting their biomechanics? I don't know. I just know that I feel that I have that ability to create something that I've never done before. Like, I make things up all the time. I make cues up all the time uh, because it's the reflection process that I'm going through and what I know that they need in terms of, because they've told me I need to be able to do this action. Then that responsiveness and creativity can then be in a place where it can happen, and the confidence to do that because I've done it a lot. And that's what I want for everybody. I don't think I have anything special. I just have a lot of practice because I'm older um, or more experienced. I don't know. I actually don't know. Anyway, we're going to talk about building this clinical intuition. So, intuition is often pattern recognition from experience. Pattern recognition from experience. I think we have it. We have an intuition about things. Some have more intuition than others, and we tend to remember the times we are right. We tend to forget the times that we are wrong. So always just make sure that you know that there is that pitfall there. Now, metacognition helps you examine and verify your intuitive responses. It encourages you to ask the questions, why did I feel that was on the right course? Is this an assumption? Is it based on evidence? Is it something that is valid that I can continue to take forwards? Because my intuition is often wrong. My intuition is often right. How does it work? How do I know when? Because, when I think I'm right, it feels the same way. I think this is it. And then I could be right or I could be wrong. And sometimes it just takes you by surprise. So being able to think about that, why is that pattern recognition important? Why is it that I think the butt wink in that person's squat is significant to their presentation, and I want to change that, and the butt wink in somebody else's presentation is not that troublesome at all, and continue doing it, it's not a problem? Like, people get confused by that. They're like, you're worried about their butt wink and not worried about their butt wink. Why? And it's that process, it's that reflection, it's that cognitive reflective processes that we've been talking about on this podcast that lets you identify what those patterns are, to be able to identify it and break it down so that you can teach it. But you got to test your clinical intuition. I still advocate that you must, so important that you must test to prove yourself wrong, not to prove yourself right. I will always find things to prove myself right. So if you keep reflecting on this and you keep testing your intuition, you begin to trust your gut in certain situations, because certain things it'll be clearer as to why you think you're right, as opposed to, I think I'm right. So intuition without reflection can reinforce bias. This is what I see the most of. Without a doubt, I see too much of this, too much of this. Because people want to believe that what their intuition is correct, right? You will reinforce your bias. You will stick to, you have this tendinopathy because of this, I don't know, instability that leads to whatever story that leads to the tendinopathy, okay? Like, people make up stories all the time. And you picked it early and you're sticking to your guns now, even though there's enough time and evidence that things are not quite right. Things are not progressing as they should. Why is that? That's where you need to go, and you need to build your clinical intuition differently, because you need that reflection. So intuition with metacognition, what we're doing here on this podcast, leads to wisdom and precision. That wisdom of, look, I think it's this, but I'm going to test to see if I'm wrong. That to me is wisdom. I think it's wisdom. I do this thing because I made so many mistakes doing it the other way, the way that I was taught. And it leads to precision. Like, people say, well, why didn't you do this? Like, somebody came in earlier today with this diagnosis and you did this with them, but you didn't do that same thing with this person. Why is that? And it's to understand why I made a decision differently, to be able to explain it, to show that the relative weighting of different aspects in their presentation, why I weighted them differently. It could have been their goals. It could have been aggravating factors, easing factors, daytime behavior, comorbidities, different conditions that presented, different actions that aggravate, different goals I mentioned already, but like seriously different goals. There are some people that need to play this weekend. It's a grand final. And then there are other people that are like, yeah, I've got a holiday in 3 months that I want to get ready for. Like, all of these things play a role and they affect your clinical reasoning. So it's important to acknowledge that and go through that process of building that clinical intuition. So this episode, let's have a look at what we've covered. It is metacognition and clinical reasoning. And so to help your clinical reasoning, there's reflection in action. So you've got to be able to reflect in the moment so that you can pivot. There's reflection on action so that afterwards you can see what has gone on and why. You've got to be able to adapt in the moment, as well as building your clinical intuition, which is in the moment and later. That way you can trust your gut. That way you can work with more wisdom, more precision. So Next time you feel stuck or unsure mid-session, this week, I want you to pause and ask, what am I noticing? What am I noticing about the patient? What am I noticing about my thinking? This is metacognition in action. Awesome. Please leave a comment. Let me know some of your metacognitive clinical reasoning strategies, things that you reflect on, how you reflect on them, how you share them with others, how you work with others, how you adapt in the moment or build your clinical intuition. I'd love to hear about it, read about it, start a discussion down below. That would be awesome. Please leave a comment. It helps with the algorithms and helps get this out to other people. What also helps is liking and subscribing to the podcast. That would really help us. If we can get to a certain level, we can do more things, apparently. So that's what I've been told. So like and subscribe. What's going on in the next episode is awareness of cognitive bias. So being aware of those BAMs and those bars that we have. We all have those cognitive biases. They are shortcuts. They do help, but they can lead us astray. That's what we're going to be covering on the next episode. I look forward to catching up with you then. My name's Antony Lo. If you like my style, if you like my content, if you like making the complex simple, well then head over to antonylo.com and find me there, do one of my courses. I look forward to catching up with you. Cheers.